being here with our impromptu tube feeding class and neonate class. We are so lucky to have Dr. Zoya from Maui Humane, and on Maui, she works with a lot of rescues on Maui. She's over here. She is Pickle's mother. If anybody's been following Pickle on social media, she came over to visit Pickle, and we put her to work. And last night, Mary had 2 kittens here that Zoya was helping her with, and we just came up with, actually I came up with a brilliant idea of like, hey, do you want to do a bottle feeding class? And Zoya was like, yeah. So here we are, and thanks all for coming. It was super impromptu. And we have 3 baby neonates that just came from UC Davis this morning. They are about 2 days old. They're a little bit overdue for their feeding, so we're gonna get them fed. And then we have Mary's, who are about a week old, and she's been tube feeding them as well. So we've got lots to demonstrate.
These were last, their last feeding was at 11. So
at 11, okay, so we'll do those
So
last.
those will be.
Okay, so Zoya, I'm gonna let you take it from here. I'll get your heat just when it's warm.
Great, and then can you get me a baby bottle, a 3.5 French, and 5 to 6 cc syringes.
Okay.
Hi, good morning everyone, or good afternoon.
It's morning Maui time.
It's 10 a.m. for me in Hawaii time. Who here has bottle fed before? Who here has had kittens that their eyes were still closed when they were bottle feeding? Who here has tube fed before? Great. So lots of different experience levels. So we've got these little teeny tiny kittens that were found at a gas station last night. And what they are 2 days old, 2-day-old kittens. They need to be fed every 2 hours because they need to be kept warm and they need to be kept hydrated. Those are the 3 things that will decompensate kittens the fastest, is if they get dehydrated, if their blood sugar drops, and their blood sugar can drop really quickly if they're not fed every 2 hours at this age. And if they're too cold, if their body temperature drops below 96 degrees Fahrenheit, then if you feed them, their food does not digest. Instead, it will just fester inside of them, and it can lead to GI dysbiosis, diarrhea, and possibly eventual death. So they're really delicate at this age. So these 3 were last fed at 8 a.m. So that was 5 hours ago, so they're all starving at this point. And when I tube feed my kittens, I have a little trick, because when we're tube feeding, they're extremely fragile at this point. If we're not suckling on our own, there's something a little wrong right now. Whether it's we're not used to the baby bottle yet, or they're feeling a little sickly and need additional support to be tube fed. Yeah, if we're not latching onto the bottle, if we're not suckling, if we're refusing the bottle, we have a weak suckle, you're trying to trickle feed them and they're kind of eating, but like not really, they need to be tube fed. So when I start tube feeding, I make a little chart for my kittens so I can record how much we're feeding, if they're getting any additional things such as antibiotics. One of these babies is on Clavamox because he's got some blood in his urine. So Clavamox is an antibiotic that we can give to these little babies that's safe enough to give. I'll mark down the tube feeding amount. When I stimulate them to potty, I'll also mark down have they peed, have they pooped, their pee color. Pee color should be a very light straw yellow. If it turns into a darker yellow or a dark yellow, then our kitten is dehydrated and we need to either supplement them with subcutaneous fluids or dilute their formula a little bit more, either with just plain Pedialyte without added sugars such as xylitol, because xylitol is dangerous. Or we need to give them subcutaneous fluids. And lastly, we need to be recording their pre-feeding weight and post-feeding weight. This is important because at the end of the day, every 24 hours for the first, while we're still bottle feeding, kittens should be gaining 10% of their body weight. So the way you calculate that is, say you have a 120 gram kitten just move the decimal point over 1, so they should gain 12 grams over the next 24 hours. So that means that we're gaining weight appropriately. If we're not gaining weight or if we're losing weight, that is definitely a sign of concern and needs to be further explored as to why we're not gaining weight. During the first couple weeks of life, kittens have temperatures that they need to be maintained at, because when they're born with brown fat, so baby fat, and they also cannot regulate their body temperatures. Because they can't regulate their body temperatures, they need additional heat support to maintain over that 96 degrees Fahrenheit in order to digest their food. So if anybody has an incubator with a temperature setting, or if you put a thermometer probe into your incubator, for the first week of life, the ideal temperature range is between 87 and 90 degrees Fahrenheit, and then by week 2 we decrease that to 85 to 87 degrees Fahrenheit, and then the last week will be 80 to 85. That would be between week 2 and 3, and then at 3 weeks I usually just give them as long as everybody's doing great, I just give them a heat disc that they can climb on or off of, because by between week 3 and 4 we're able to regulate our own body temperatures. So with tube feeding, we use red rubber catheters, and when we're tube feeding, we are trying to reach down into their stomach with the feeding tube, because if you don't make it to the stomach and it's just sitting in the esophagus, they can cough up the milk and potentially inhale it. So the way that you know how far to go with the feeding tube, you'll measure from the tip of the nose to the last rib. And I like to use either a Sharpie marker or a piece of tape and mark that down. If it's all kittens from the same litter, they're usually around the same size, so I'll keep it at that same mark and I'll tube feed them the same way. So that's the first thing that we're gonna do. Then we're gonna make sure that we have warm milk. So I like to have a cup of water that I'll just microwave, and I will use a 1 to 5 cc syringe, because kittens, when they're less than 1 week of age, depending on their weights, you guys will get a kitten stomach capacity chart, and this chart will indicate, depending on their weight, how much their stomach can tolerate. Because some things that can happen with tube feeding is if we overfeed the kittens and overinflate the stomach, that can cause GI ileus or GI dysbiosis, lead to massive diarrhea and possibly eventual death. So we can't be overfeeding them, we can't be underfeeding them. We gotta get it just right. So these kittens are, kitten 1 this morning was 103 grams, kitten 2 115 grams, kitten 3 96 grams. So Joy, does everybody have these charts? Okay. Kitten will get about between 3 and 5 milliliters of milk. So we will draw up 3 to 5 milliliters of milk. So here's our syringe. And usually for my kittens, a brand new syringe will make it very easy to just kind of slide the formula, because as these syringes, as you reuse them, they become tougher to push, and sometimes you can't feel when you're using too much pressure or not. So I usually, with these little guys, I'll use a syringe for maybe 2 feedings, and then I'll switch it out, just to prevent that pushing too much pressure into their stomachs and causing that overinflation. Other potential risks of tube feeding is accidentally getting into the trachea, which is into their lungs, which we don't want, because if we put milk into the lungs, we're gonna cause aspiration pneumonia, and there's gonna be a high likelihood they're gonna die if they get milk in the lungs. Other things that can happen is if you're too forceful with the tube, you can either perforate the esophagus, you can perforate the stomach, basically tear through it. So we don't want that. So we're gonna draw up some milk for kitten 1. So the red rubber catheter just slides onto the tip of the syringe like this. There's 2 little holes at the end of it, and I like to draw up milk with the syringe. through the catheter, because that way there's gonna be no air in there, because you don't want to be pushing air into the stomach either.
So it has to be a lower lock syringe?
Not necessarily. These ones will fit both Lurlock and the slip tip. So we're gonna draw up some milk. This is gonna take a little while to fill. So other tube feeding tips. The esophagus runs down the left side of the neck. So when I pass a feeding tube, I will hold a kitten's head stable and then enter the mouth through the left side, and just very, very gentle. We don't wanna, if you feel resistance, don't keep pushing. The kitten will be, they hate being tube fed because they don't understand what's going on. They eventually may get used to it, but most of the time they will try to fight you on it. So we're gonna slide in the left side of the neck, and how we check for if we are in the stomach or in the lungs. 1 second, pushing the air out of here. To check for if we are in the stomach or the lungs, there's a couple different things that we can do. One is if the kitten is screaming with the tube inside of it, you're in the stomach, because they're not going to be able to vocalize while there's a feeding tube in their trachea. Secondly, we're going to check, the most important thing is you check for negative pressure. What I mean by negative pressure is if you're in the lungs and you draw your syringe back down, you're going to get air in it. So there's going to be an air bubble that gets sucked into it. You can't really see it from here because this is full of milk, but there's a big air bubble in here now. If you get an air bubble when you draw your syringe back, you're in the lungs. Pull out and try again. If you are in the esophagus, when you draw back your syringe, you're gonna get resistance. You're gonna draw it back a little bit, and then it's going to push back up or suck back up because there is no air. So as you're trying to suck back, there's nothing to suck back, and the plunger is gonna go back forward. You just need to do it just a little bit, and it will suck back up. So you're in the stomach and or esophagus at that point. The kitten will be trying to fight you. So when I hold my kitten and I pass my feeding tube, I will also hold the head and or feeding tube at the same time. They will be trying to back away, or they'll be trying to push the feeding tube out of their mouths. That's okay, that's normal, they always do that. When you first start giving them milk, give them the teeniest amount. And if there's no coughing, if they're not extremely distressed, then you're in the right place. If they start coughing or milk starts coming back out, you're not in the right place. You're likely in the trachea or in the lungs. So as long they'll usually start to chew on the tube and make swallowing gestures as you're pushing the milk in. When you take the feeding tube out, you want to basically pinch the side of it, because as you're drawing the feeding tube out, sometimes milk will continue to leak out of these little ports, or they might suction milk out of these little ports as you're pulling it out, and it might go into their lungs. So it's important to clamp off the feeding tube, pinch it, and then pull it out so they don't get milk in the lungs. Okay, so we're gonna get our first kitten. We have our heat disc, and I'm also going to ask for a thermometer. We're gonna make sure that we are within the correct temperature range to digest our food.
I'm gonna just stuff it. Oh my goodness.
Hi, little teensy weensy. Oh my goodness, you're so little.
Come on, look at the
Okay.
face. Let me see the face.
Hi, little sweet pea. Oh, you're so tiny.
Yep, that's okay, sweet.
So what is the weight of a newborn kitten? It's a normal weight for a newborn kitten.
Usually I see them around like 80 to 95 grams. That's usually like a healthy range, but like sometimes they can be born way smaller. They can be somewhere in the 50s, or they can be kind of big, like 105 grams, but usually it falls in like that 80 to 95 gram range. These guys still have their umbilical cords attached, so they're less than 5 days old. The umbilical cord will fall off once they hit about, usually exactly on day 5 it falls off. And then they'll start opening their eyes around day 7 or 8, and they start opening their ears around day 7 and 8 or 8, and they should be fully open by day 10 to 14. Hi, little one. So we're active, we're seeking food right now. So before I actually tube feed my kittens, I will check and see if we have a suckle reflex first.
What?
A suckle reflex.
How do you do that?
So I'm gonna stick the nipple into their mouth and just give it like the tiniest little squirt, just like a drop, so they can taste it and understand that there is milk coming into their mouths. If they start to suckle, great. We should be eating between 3 to 5 mils for this one. If he suckles this entire syringe, I'm not gonna tube feed him. If he doesn't, I'm gonna tube feed him the rest of the amount that he did not eat. We're gonna check his temperature, just because I'm meeting this kitten for the first time. Okay, so kitten 1, right now our weight is 100 grams. Our last recorded weight was 103, so we are likely gonna lose a little bit once we pee or poop.
Yeah, we'll just leave it on.
So we're gonna stimulate him to potty.
Malfunctioning equipment.
Yeah.
You quit crying for that.
Did he drink pot?
Not yet,
No.
we haven't tried yet.
Oh, you're pottying first.
All right, Mom.
Okay. Okay, so his urine is a little bit dark yellow. There's a little bit of blood in his urine, as was noted here previously. He is on antibiotics for that, but we're a little dehydrated. We haven't eaten in 5 hours. We should be eating every 2 hours. So we're gonna take his temperature, make sure we are at a safe body temperature to digest our food.
Sorry, buddy.
Do you temp each time you feed?
Not each time. If my incubator settings are right, then I shouldn't have to temp him every time. Okay. We are 98.7 degrees Fahrenheit, so we're safe to feed. So let's see if we latch. So we're not really latching, we're kind of like, so that's okay. We're gonna feed him supplementally. So we're gonna measure from the tip of his nose to his last rib. So his last rib is right over here. And we are going to about here. So when we turn his little head, boop, tip of the nose. So we're gonna insert the tube about this much.
There is I did put a
Sharpie marker, yeah. So I'm gonna Sharpie that onto the feeding tube where we're gonna go. Okay, so here's our little mark to where, how far we go.
I just want to get up closer so you can see. Yeah, please,
Yeah.
don't, you don't have to lean
Yeah.
back here.
Yeah, feel
This
free
is kind
to.
of a close-up thing.
Yeah, I know, this is hard to see from a
Did you
distance.
tell him I ate chili?
Take your chair, you can take your chair, here, here you go. I did, Cheryl.
So,
This is where we need the Jumbotron.
Yeah.
so we want the tip of the feeding tube to be a little lubricated. You can either do it with water or with milk. Since I dipped this into the milk to suck up the milk into the syringe, it's already a little lubricated, because if you go in dry, then that can cause a little bit of resistance or like esophageal tearing. So this guy's hungry. we're gonna take some time to figure out the bottle, but I'm gonna take control of his little head. So I'll pinch it between my thumb and my forefinger, and I'm gonna go in from the left side of the mouth. So very gently, we're gonna slide it in, not getting any resistance. If you feel any sort of resistance, stop pushing the tube. So we're in up to the black mark. That's where I feel the bottom of the stomach, because as I'm inserting the feeding tube, I do feel a little pause. So that's where I stop. So I'm gonna make sure that we are actually in the esophagus, and I'm gonna draw back the syringe. This is something you might wanna, so right here, you see how it bounces back? I draw it back just a teeny bit and it bounces back. I'm not getting any air. So that means I'm in the right place. And we're gonna feed very slowly over 20 to 30 seconds, because if you feed too fast, they're gonna cough up milk.
He's chewing a little, isn't
Yep, we're chewing a little bit.
he? So he thinks he's eating.
So he's, yeah, he's basically eating.
Yum. And swimming.
Why is this formula taste like rubber?
Yeah.
So mellow, it's not fighting. So used to fighting.
He's so happy to have fun. Look at that little face. You silly baby.
There's so much difference between that kitten and my kitten right now. With its, with its leaning and the way it's feeding, it's that weight makes so much difference.
Yeah.
It makes so much difference, yeah. Well, my little kitten actually does chew a lot, yeah. I have a hard time keeping it in her mouth.
Yeah, they try to spit it out a lot of the times.
She chews so much that I can trying to push it back in. Yeah.
I think I've been going way too fast.
Okay.
Going way too fast.
So I'm feeling a little bit of change in resistance as I'm pushing the milk. So it should be, as you're pushing it, you should be, basically the syringe should be, the plunger should be sliding in. As soon as you feel it getting a little bit more difficult to push, that means the stomach has hit its capacity. So we're going to pinch the tube, just like this, and then pull it out. There you go. So we got about 3.5 milliliters in.
Oh, yeah.
Are you okay? Yeah, we're okay. And we're gonna weigh him again.
Zoya,
We are 104 grams now.
she had just asked.
Oh, so you said you're okay, what would you see that would indicate not okay?
Coughing, suddenly they're lethargic, if they start to like gasp for air, and an inability to vocalize, they look like they're screaming but no sound is coming out, that would be likely that they aspirated some milk. Sometimes also if you're feeding them, if they're trying to scream while you're feeding them, that can push milk up out of their stomach. So if we're screaming while you're feeding them, I would stop feeding for a second, wait for them to stop vocalizing, and then continue pushing, because sometimes that screaming will cause compression of the abdomen, they're screaming, and that will push some milk up, and they'll cough up a little bit of milk. So I'll stop, I'll wait for them to settle down for a second, or for that period of time between them not screaming, and then I'll continue pushing a little bit. So,
And if they did aspirate, what would happen, what would you do?
so there's two things that you can do. One is if they aspirated milk. Another thing that you'll be able to hear if they aspirated milk is if you listen to their lungs, you might hear a clicking sound. That clicking sound is fluid popping off the alveoli as their lungs inflate. So that would be an emergency situation. You'd either come back here or go to the nearest emergency vet. If they aspirate, they will either need to be on antibiotics if it's a mild aspiration. If they aspirated a lot of milk, then unfortunately they might have to be euthanized, because otherwise they'll just be struggling to breathe as they're drowning in milk. So our pre-feeding weight, not to scare anybody.
Yeah, I was just gonna say, don't, I mean, a lot
It's
of people do
Always
this.
scared.
Yeah, you're saving their lives, and
you know, but it's very, I don't want to say very rarely happens, but it, you know,
Yeah.
just being cautious, being cognizant.
Zoya did give a lot of good precautions to avoid that.
Yes,
The different
yeah.
tips.
Yeah.
Well, the resistance.
Yeah.
That was not
Yeah.
something I learned something.
Good.
Yeah.
Okay, and we did 3.5 mils. Okay. So, babies at this age, all they should be doing is eating, sleeping, peeing, pooping. If they're doing anything else, something's wrong. If we're screaming, if we're continuously rooting around and trying to, and suckling on things, we're probably hungry. But if we're continuously screaming, there's something going on. So yeah, this is normal behavior. After we eat, we just fall right asleep.
Food come on.
This looks like after Thanksgiving dinner, right?
So
Okay.
they don't have a gag reflex, right? When they're this little?
Mm-mm.
So this one's on antibiotics
This one is on antibiotics.
and you're giving it orally?
You're giving it orally, but it's such a teeny tiny amount that you just kind of squirt it into their mouth. I wouldn't worry about aspiration. It's like a drop that they're getting. Okay, so kitten 1 is done. Afterwards, just because his urine was a little dark yellow, I'm gonna give him some subcutaneous fluids.
Okay.
But we're gonna get
Says what?
the other ones fed.
Okay,
So
I'll take you back.
I do have a question. When do you stimulate him to go? Is that before you feed?
Usually before I feed, I'll
Okay.
stimulate them to potty because the mama cat will, when she stimulates her kittens or she's grooming her kittens, the kittens understand that mama's there, so they'll start rooting around and looking for a nipple.
Okay, this one is the orange one.
The
Oh,
orange one, is
God.
that kitten too?
I don't know.
Not the orange.
I'm not sure if that was kitten 1 that we had. I should go look and see. This is kitten 3.
Oh, kitten 3.
Okay,
Okay.
let me go back and look at kitten 1 that we just did
Okay.
and make sure. I think that was.
Oh,
All right, so we've got kitten 3 here. Kitten 3 is hangry.
very.
So we're gonna get his pre-feed. Actually, any milk that they produce is very dense in antibodies, and their gut tube is what we call open. So everything that they eat in the first 24 hours gets absorbed systemically, including their antibodies. We don't know the immunity status of these kittens, so we're always gonna wear gloves when we touch our neonates.
Okay, so this one is, that one was 1, so we're on 3.
We're on 3.
So-
So we're gonna take our pre-feeding weight first.
Okay, but I want to put the time first here, right?
Yeah. So
What time is it?
it's about 2 p.m.
Okay, so wait. And once you get, once you get this going and you're got it down to a 95,
95.
and you got it
grams.
down to a science, and you wake up at 3 a.m. to feed these guys, how long would it take you to feed them?
For me personally, maybe like 30 minutes tops.
So that's
I was back to bed last night in 30 minutes.
cool.
Yeah, and most of that time is like heating things up. The actual tube feeding and stimulating them to potty probably takes like 2 minutes.
So next thing I want to simulate them.
Next thing you want to do is stimulate them.
Okay. Are you gonna pee or poop for me? Huh? Are you?
You've done this before, right, Joy?
I've done tube feeding, but not on a real regular basis.
Are we crowning there? Is there a poop crowning? Yep.
Ooh, ooh, oh.
Oh, get it.
Give it to her.
Yeah.
Get her.
Oh yeah, we're getting poop
Oh yeah.
out.
Yep.
We're
Keep
getting some
going.
poop out.
Don't stop. Keep going.
Keep
Once we
going.
start going potty,
All right, just keep it going.
yeah,
keep it
they'll
going.
be pushing. You'll see them pushing, but once they stop pushing and start kicking around and screaming, that means we're done pottying.
Oh, how cute.
Yeah, one of my personal things is I usually don't do bottle babies because I like to sleep. But but we all have to sometime go out of our comfort zone, right?
Yep.
So, and you're never too old to
It's
learn
not
new
intentional.
things. Yeah.
That's my case.
Yeah, right. You just suddenly you have them, right? All right. So we didn't get any pee, but we did get some good poop.
I think we did get some pee.
So did we get a little pee in there too?
I think so. Yeah.
All right.
Yeah.
All right. Okay.
Okay.
So
So
Let's look at that tissue, just so you can point out what.
that's
so-
probably pee right there.
yeah, we did get a little bit of pee in there. We got some poop.
Okay.
Can't really comment on the poop consistency. He didn't get like a full nugget out, but it's not diarrhea.
Yes, yes. Okay, so
But-
yes, yes.
Pea color, I would say like yellow.
Yellow, okay. Stool consistency, kind of normal.
Yeah, I would say normal.
Okay. All right.
All right,
So
and then
now
we're gonna see if
gonna
we
do
are
the
suckling.
temperature. You want to do temperature
Oh,
next?
yeah, let's
Okay.
do temperature next.
Sorry, buddy.
Get them all
Kind of
lubed
like
up.
getting a colonoscopy or something.
Oh, stop it.
I wasn't gonna.
You just aged yourself.
Yeah.
Yes.
Yeah.
I've had a few.
Oh gosh. Come here, little butt. Yep, there we go. All right. Oh, I know. That's just rude. Hi. Hello. You're so cute. You're so cute. I think these are the slow thermometers.
Yep, it took a very long time.
Yeah.
Poor guy.
I mean, 'cause I know he's better than that. Still going, but not fast. That's pretty low, huh?
That doesn't seem right.
No.
Yeah, don't push it in too far with them.
92.5.
Let's
So,
try a different thermometer.
Joe, there's some out in the. Yeah, let's try a new.
So when I'm done feeding them, so say this has no milk, I just kind of continuously suck up from like a warm cup of water. And
And
then,
then do you push through? I'm sorry, I'm asking 10
No,
questions.
no,
please do, please do.
So when you push through in the beginning, like I've been pushing through to make sure the milk's down in the tube first. Is that?
yeah, to make sure that all of the air is pushed out of the tube.
Is that okay? So
Mhm.
that's the right thing then.
Yep.
Okay.
Let me get his little turd out.
Oh.
So if they're having diarrhea, I will always supplementally give my kittens subcutaneous fluids because in these little guys, they can get dehydrated so quickly and like develop dangerous levels of dehydration.
What's the amount of sub-Q you would do on somebody that size?
So if we're 100 grams, I would need to convert that to pounds.
All right, we're gonna try this again, buddy.
Okay.
It's 0.22. I had 100 grams just recently.
What's that?
0.22.
0.22. So I would probably give about 3 mils. 3 mils of sub-Q fluids, and that would be 3 times a day because normally in an adult cat you would do fluids like once a day, but because these guys have such a fast metabolism and we're so little, 96.1.
That's so
Okay.
low.
That's
isn't it?
still low.
We're not below 96,
Oh, you know
so
what?
we're okay.
We got poop on there, so that's probably why.
But we're greater than 96.
Okay, so
we
we're
can,
okay.
We
But,
can,
yeah,
Joy,
okay.
why did you look at me when you said poop?
And when you do sub-Q, do you tamp the same way you do an adult cat?
The same way. Yep, same exact way. And I find these little guys much easier to give fluids to than an adult cat. Because an adult cat can fight you, these little guys you can just kind of hold them.
And is their hide softer to get through than like?
Generally, yeah. And I would use like a really teeny tiny gauge needle.
Yeah, okay.
Okay, so now we're gonna try. I just put the temperature over there because we didn't have a.
Right. Oh, yeah, we should have a temps.
It's all right. Because you're not gonna do the temp every time.
No.
It's okay. Put it in there.
Hey, buddy.
Okay. So we're gonna offer him just like a teeny tiny drop of milk.
A little bit of bubble in there.
All right. Okay. And we're gonna hold the kitten flat down.
That's right. In your head. Okay. Come on.
Give him just a tiny little drop. Keep going, dribble a little bit. Okay,
No,
he does not seem to
He's-
want to
no, he's
eat
not.
suckle
He's
from
like,
that.
Ick.
So we're gonna tube feed him.
Okay.
So we were 96 grams
Yeah.
or 95?
All right, 95.
95 grams. So we will be between,
96 degrees.
we will do between 3 and 4 milliliters for this
Okay.
one.
All right. So first
Okay,
thing I'm gonna
so
do is
Push out the bubbles.
push out the bubbles.
So hold the syringe straight up.
Okay. Like that. Good.
Yep.
All right.
Perfect.
And then I just stick that in there like
Yep.
that.
To lubricate
And
it.
then do we remeasure or are they all about the same?
They're all about the same size.
Okay.
Yeah.
All right.
So we're gonna go in the left side of the mouth.
Wait a minute.
That's the left.
Put him
Okay,
towards you,
stabilize
Joy.
his little head.
It's left.
Very, very, very gently. If you feel any resistance from the left side, yep. Yep, keep going. We're chewing. If you feel any resistance, stop. Okay. Okay. That's a good stopping point.
All right.
Okay, aspirate back a little bit, just like tiny bit, and let go.
Is that, oh, I got a little air in there. Does that feel like air to you?
Let me see.
Yeah, you do that.
Nope. So
No,
look,
okay.
look at the plunger here.
Okay.
Yep.
All right. I think there was like a little bubble there maybe.
Yeah,
Okay.
so
So,
we're
now we're
okay.
going to do, what are we
Very
doing?
s-
3?
Slow push, 20 to 30 seconds. Very slow push.
Okay, but we're doing
So-
3, right?
He's, yeah, about 3 to 4. You'll feel a little pressure
Keep his
change.
little head like this.
Mm-hmm.
Sorry, buddy.
So keep pushing very slowly. He's chewing and swallowing. That's a good sign. He just vocalized. He's continuing to vocalize, so we're in the right place.
No, keep your little head straight. No, keep it up here.
Good job, little baby.
Hey, say good job, Joy.
Good job, Joy.
All right, so that's 2.
Yep.
So keep going a little bit.
Yep. And then you'll start to feel a little pressure change, likely between 3 and 4. And once you feel that pressure change, you stop.
So it's just a resistance.
Yeah, like resistance. Once you feel a little resistance, it's like filling up a water balloon. Like once it gets to its maximum capacity, it's going to be harder to push.
I'm still feeling like I can go, but it took a lot. So we're at 3, 3 and a half.
The tube's coming out a little bit, is that?
If it comes out a little bit, that's okay. Like a little bit of, because they're gonna try to spit it out sometimes. If it comes out a little bit, that's fine. But if it comes out like about halfway, that's when I'll
Should I stop
slide it
at
back
4?
in. Yeah, stop at 4.
Okay.
And then pinch it. Yep. And then pull it out. There you go.
Good job.
Look at your little face. You got a milk mustache.
All right. And let's give him a post-feeding weight.
$98.
98 grams. So that's good. So we gained about 3 grams, but we also peed and pooped, so we had a little bit of losses. And then tube fed amount, we did 4.
Where's that go? Over here.
4 mils. And then for suckling, you can put pour.
Okay, because yeah.
Yeah. Okay, and then we'll
Dude, you're
get the next
done.
kitten. Good job.
Now you're gonna make him throw up.
Okay, who's gonna do next? And then with every subsequent feeding, they'll start suckling more and more until we're just like ravenously.
You got little pink
Oh.
color.
All right.
Got a mad one.
All right.
Okay, so that whole thing, Joy learning to tube feed for the first time, that took 10 minutes because we started at 2, it is now 2:10. So,
All right, so you got a hungry one.
I, you know, the one that does not been that tight.
okay. All right, so we're gonna start off with
What's
pre-feeding
he
weight.
doing? That's my phone. What's he doing?
It's recording everything. You'll send it to somebody.
Yeah, probably.
Ooh, you're the biggest one. Okay, so we're 114 grams.
Pig.
Can mark that down.
You're just a pig.
Oh, right here for kitten too.
Oh, I see.
Okay. So we're gonna stimulate the potty next. I know. Can I use this water or that one? This one's warm, so you can give it a little dip.
Oh my.
He's got like a nest.
Oh yeah, we're pooping. Keep going.
I think it was already on there.
Oh,
Yeah.
He's going on his own.
keep going. We're still squeezing. I can hear him grunting. Keep going until we stop grunting and stop stretching out our little leggies.
He's got a plus. I mean, there's some stuff dried on there, isn't it?
So stretching out the legs is an indication.
Yeah, the stretching out of the leggies is like they're pushing.
Where's my- Oh, messy boy.
Good job, buddy. I know.
You do.
I know, we're so little. All right,
Oh, nice job.
good job. All right, so we want to keep them cleaned up really well afterwards so they don't develop dermatitis secondary to like urine scalding or like poop scalding.
Use baby wipes, right?
Yeah, I'll usually for stimulating my kittens, I'll just use baby wipes from the
Okay.
get-go. I get like the big packs from Costco,
Yeah.
and I'll use baby wipes on all of them because
You
it'll
have a lot of
simultaneously
babies,
clean
right?
them up.
You buy you run a nursery?
Good job, buddy.
My goodness.
Should I like clean up? I don't know. He's still pooping a little bit.
Oh, then keep going.
Dude,
Keep going.
how much weight do you think he'll lose on that?
We'll see.
I'll get you some more.
Yeah, we don't.
Good job, buddy. You're a pooping machine.
Oh, okay, oh, okay.
Oh, buddy.
Okay. Oh my God. I don't understand. Turn it off, whatever it's doing. I have no idea.
Do you think he's still pooping?
Let's see.
Yeah.
There's a little poop grunt. Let me grab this little guy.
Just do it. It's new. Legs.
You want me to, I'm going to bring it to you. Oh, because it's new to you.
Oops, yeah.
Okay. I don't think we're pooping anymore. We just have some schmutz stuck to us.
For a second.
So this one was 115 grams. So looking at our kitten stomach capacity charts at 115 grams, we should be eating about 5 milliliters per feeding.
Oh, he's a chunkster.
Let's get him all cleaned up here. I know it's hard being gross.
It's a dude. Is it a dude?
No, this one's actually a girl.
Oh, whoops.
How much is he gonna eat?
So out of well, you tell me. Look at this chart, and we're 115 grams.
It's like 5.
Yep, 5 pounds. Okay, so we are all cleaned up back here. All right, no more poopy kitten. 98.6. Oh, there is not. You can just put it on other. Okay, so let's see if we suckle first.
It's a little bit soft.
That's good. Great sign. We're suckling a little bit.
Yeah, a little bit.
Yeah, but not enough to drink that entire syringe.
No.
So we can switch over to tube feeding. So push all of the air out first. You want to have the syringe facing up. Yep, and I just keep going, keep going, keep going. Oh. Keep going. Yep, we're vocalizing, so We're
Okay.
likely in the right place. And then suck back on the plunger a little bit. Suck back first.
Okay.
Great, we're getting that negative pressure. Give him a little trickle. Make sure we're not coughing.
Okay.
We're not coughing, we're fighting. And then slowly push over the course of 20 to 30 seconds, the entire amount, unless you hit resistance or a change in resistance, then we'll stop there.
He's giving his opinion.
Should I hold his head straight?
I usually do, because otherwise they can do like, sometimes he's trying to swipe the feeding tube out.
Yeah.
So you're doing a great job holding his little head and holding the tube.
And he's doing a great job of being a pain.
Yep. Yeah. I know.
Enjoy your food, dude.
Oh. Oh. I know. Tell me all about it.
I think that's like
Good. All right. So pinch the tube and pull it right out. Okay. Good job.
You happy now?
And then let's take our post-feeding weight. I know, little one.
There's one in every crowd. Every
17.
family.
Great.
One in every family.
Great. Perfect. All right. And back in the incubate he goes.
All right.
Tubes, I'll stick it into a cup of warm water. And put my syringe back on. And I just suck up water.
So will you repeat the botulism?
What's that?
Will you repeat the botulism?
Yes.
We were filming.
So we want to clean our feeding tubes after every feeding, and the way that we do that is by sticking it into warm water, and then I like to just suck up water until we are getting clear water coming into the syringe. We want to clean it because milk likes to grow bacteria, especially at room temperature, and the type of bacteria that milk really likes to grow is botulism, and we don't want to be giving our kittens botulism or other bacterial infections. So this will take a couple of times. And then the last one, when I suck up and I'm getting clear water, so I'll do half clear water and then half air. So then I flip it upside down and I flush it through all the water, and then the air will push all the water out of this. So there's air in this, so there isn't just water sitting inside of it, and it's flushed through and clean. And then the syringes I usually use for about 2 feedings, depending also on number of kittens. If you start to feel like it's getting like gummy or like hard to push or suck up milk in the syringe, switch it out, because a fresh brand new syringe will be very smooth and easy to push, and you'll make sure that you're not over pressurizing the stomach. Any questions?
Good job.
Well, what do you do if like their stomach feels like hard, or if there's gas or something?
So if their stomach feels hard, usually it could be a couple things. One, if we fed a cold kitten and milk started to curdle in their stomach, that might cause a hard stomach. Most often, that's not the case. When we feed them and their stomach is full, that will cause a firmness in their belly. That's one of the ways that as you continue to feed kittens or bottle feed or tube feed, you'll learn to feel for what the belly should feel like after the feedings. They should feel plump. They shouldn't feel flaccid and deflated. They should have a little plumpy feeling to them. Other things that can cause the stomach to feel hard is if we injected air into the stomach when we were tube feeding. So if we have a gassy kitten, some things that we can do is burp them. So you hold them straight up like this, because air likes to travel up. And I just use 2 fingers to just gently pat their backs like this and burp the kitten. Usually I like to burp my kittens when they're little, about after every feeding, because when they get really gassy, that can make their bellies hurt and they'll start crying. Another thing that I've used before for kittens is baby simethicone. Simethicone is something that you can get over the counter at like CVS. I think it's called like SIMETHICONE, and I will just draw up like a drop of it and give it before or after every feeding, and that will help eliminate gassiness. If you have a kitten that's extra gassy and their belly hurts, you'll feel like a very distended belly and they'll be crying and uncomfortable. So those are the cases I would give that. And the baby one specifically, it's something that we use for human babies too, for gassy human babies, but we'll just do one drop like that with these little guys.
Good job, Zoya,
Yay.
thank you.
Yay.
Thank you.
You're welcome.
That was amazing, that was so good.
Yay! Thank you guys for, now